Welcome back to Focus on Health. In case you're joining us right now, we're talking about breast cancer. So from our case study, you've already heard from the patient's experience. So let's now hear from Daktari. Daktari, welcome to Focus on Health. But even before we head down to our topic today, breast cancer, kindly introduce yourself to our viewers.
Good afternoon, everyone. I'm Dr. Adarsh, oncologist, basically clinical oncologist. I deal with both radiation aspect as well as chemotherapy aspect of cancer.
Daktari, so let's head down to our topic today, breast cancer. How would you define breast cancer?
Cancer as such, it's a disease which is due to unregulated or uncontrolled growth of tumor. It can occur in any part of the body. So if it occurs in breast, it is called as breast cancer.
Daktari, what are the signs and symptoms of breast cancer, or rather how does it manifest itself?
The symptoms could be like you may experience a lump in the breast, any change in the size of the breast, or any nipple discharge. It could be clear or bloody, or any skin changes like dimpling of the skin, or you can even note a swelling in the armpit or in the lower part of the neck. These could be the changes of breast cancer. Depending on the stage, the symptoms could vary.
Daktari, do we have a specific cause of breast cancer?
Cancers, there is no single risk factor. There are a number of risk factors. Like if it comes to breast cancer, also age, if you consider advanced age, early menarche and late menopause, these are the two things. Basically, it's the number of menstrual cycles, the amount of estrogen which is on the breast exposed to estrogen. It depends on that.
Daktari, what about inherited breast cancer? If maybe a family member has breast cancer, would that put you at a risk of being predisposed to breast cancer?
One of the risk factor is also genetic inheritability. So there are certain genetic mutations which runs in the family, like BRCA, BRCA. So like if the person is having that genetic mutation, they are more prone for breast cancer. Not only breast, there is other cancers like ovarian cancers, etc.
For those who drink alcohol, could the consumption of alcohol predispose them to breast cancer?
It's one of the risk factor, but it's basically a combined multifactorial, like a number of risk factors can predispose to the development of breast cancer. As such, alcohol intake is directly not so related.
Daktari, what about obesity? Is it a risk factor to breast cancer?
The more obese you are, there is more content of estrogen, which is converted in the fat. So the amount of estrogen in the body will be more. So obesity is one of the risk factors.
Daktari, we have women who have never delivered, so let's say they have never been pregnant, or those who deliver at an older age, perhaps 40, 50, are they at risk of developing breast cancer?
So it is also one of the risk factors. We call it as the nulliparity, not having any children, and as well as the late pregnancy, the first child after the age of 30 or 35. So because basically it's a balance between the two hormones, the progesterone and the estrogen in the body. If the woman in her lifetime, if she is exposed to more number of cycles, menstrual cycles, and more estrogen exposure, that more likely chance of getting breast cancer. It's not that only, like there are other risk factors also contribute, but it is one of the significant factor.
Daktari, how do you go about diagnosis of breast cancer?
Most of the patients, they present with lump in the breast. Even nowadays we are also, because of lot of screening programs, we are detecting very early stages. Once the patient comes with lump, it's a triple examination, triple test we do. Like one is clinical examination, we feel the size of the breast, involvement of the surrounding structure. The other thing is imaging. Either it could be the basic from mammogram, which is the X-ray of the breast. From that one, we can sometimes order ultrasound examination. Sometimes for certain types of breast cancer, we also do MRI of the breast, both the breast. So imaging wise, and confirmation is always from the needle test. The basic test, the lumps can be tested by FNAC, fine needle aspiration cytology. They put a needle aspirate and they see in the microscope. but that is very basic test. That doesn't conclude. Always we take a small piece from the lump. If the lump is very small, we can take the entire lump, or if it is very big, we just take a small piece and check in the microscope. That is the confirmation of the cancer.
Dr. Shari, are there instances where one is diagnosed, but maybe you don't have breast cancer, but you have another breast condition, and maybe that breast condition in the long run, develops into breast cancer?
There is also a condition called fibrocystic disease of breast, which is more common in younger people, like the fibroadenomas, which are benign tumors, but over a very long period of time, there is a small risk of progression to breast cancer.
Let us talk about treatment. So one has already been diagnosed, you have breast cancer. How do you go about the treatment?
Treatment side effects, all treatment comes with a effect and side effect, like surgery, the removal of the breast, cosmetic implication, and there will be, depending on the nodal dissection and everything, there will be arm edema the patient can develop, the swelling of the, particularly on the upper limb. Okay, it could be from mild to moderate to severe. Okay, apart from that one, mild pain they can experience, which can persist for longer time. Sometimes fluid collection there, it's called seroma collection, which can be taken out. When it comes to chemotherapy, there will be again acute side effects and long-term side effects. Like chemotherapy can cause hair loss, okay, nausea, vomiting, ulcers in the mouth, and loss of appetite, like this. Also, it can affect the fertility of the patient. So sometimes most of the patients, they regain, even the hair will come back, even the fertility can be resumed, but it decreases the chance of getting future pregnancies. And when it comes to radiation, again, it's a local treatment. It's a superficial. We are treating only the skin and the subcutaneous tissue. Again, it can cause the arm edema can increase depending on the whether which area we treat and everything. The skin darkening, okay. Sometimes mild cough the patient can experience, a little bit of fatigue, and again soreness of the mouth. These are the signs and symptoms.
Dr. Shari, what preventive measures should one take in order maybe not to develop breast cancer? And for those who already have breast cancer, how do they manage it?
So we have seen, like main thing is when it comes to prevention, the screening has a very big role. Okay, the screening of breast cancer, either it could be the very early breast cancers before the before the stage 1, we can detect it through mammograms. So that is needed. We recommend mammogram. Usually it is recommended after the age of 45. So mammogram can be done annually, once in a year. It's an X-ray, non-invasive procedure, which will cost around 3,000. Sometimes if it is a breast cancer month, it can be done at a cheaper price. And that's one thing. The second thing is self-clinical examination. Okay, they can examine the breast manually themselves while in a sitting position or a sleeping position, depending on their convenience. If they detect anything, they can go and meet the expert immediately. Okay, that's one thing. And apart from the screening aspect, we have prevention-wise, exercise, physical exercise, avoiding obesity, okay, limiting the alcohol intake. Along with that, we have reduced intake of more greens and vegetables, fruits. Okay. So reducing the red meat intake, these are the precautions, these are the measures with which we can reduce the chance of breast cancer.
Dr. Even as you wind up, maybe you could give us your final remarks, your clarion call to our viewers regarding breast cancer.
Breast cancer, it's the most common cancer we see across the globe. It's both we see in men as well as women, though it is more common in women. So it has got good outcomes. And it can be detected in very early stages. So if we detect in early stages, the outcome, the 5-year survival, it is up to more than 98%. So most of the breast cancer we see, they survive for longer period of time. So the prevention aspect is very important. Like the regular screening is very important with the mammograms.
Thank you very much, Daktari. It's been quite an informative session. We have come to the end of our show, and there you have it from Daktari. Breast cancer not only affects women but also men. So let us create awareness on screening and have it done as soon as possible. I've been your host, Bwari Michelle. Until next time, stay safe and stay healthy. I will leave you with the Health You segment.